Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is December 14, 2025. This video cast is on a Journal of Experimental Medicine article published 2 days ago on December 12th, titled A Circadian Checkpoint Relocates Neutrophils to Minimize Injury. Neutrophils drive inflammatory injury with clear circadian variation. The hypothesis of this study is a circadian checkpoint limits neutrophil-mediated tissue damage. They use mouse models of myocardial ischemia, reperfusion, skin injury, and sickle cell disease. Human data retrospective analysis of 2043 STEMIs or ST elevation in mice. Key pathways: chemokine signaling, CXCL12, CXCR4, BMAL1 neutrophil clock. They use statistics including ANOVA, Cosinor rhythm analysis, survival analysis. Intervention: pharmacological activation of the chemokine CXCR4 using AT12341, a synthetic agonist peptideucin. Target biology: suppression of the neutrophil intrinsic circadian clock via chemokine signaling. What do they find? Neutrophil counts correlate with infarct size and circadian injury peaks. CXCR4 activation blunts diurnal spikes, p-value less than 0.01 across models. Mechanism: neutrophils reposition into injury core, sparing healthy tissue. Clinical relevance: reduce myocardial damage without impairing host defense. Key limitations: preclinical dominance, and this pharmacological agent has not yet been tested in humans. Key takeaway: targeting neutrophil circadian biology offers timed anti-inflammatory therapy. Clinical pearls: inflammatory injury severity depends on the time of the day. Neutrophils can be modulated without immunosuppression. CXCR4 agonism mimics protective nighttime immune behavior. Chronotherapy may improve cardiovascular outcomes. Summary of this study regarding heart attacks and time of the day. In this study, ZT or Zit-Geber time is the standard circadian reference used in animal experiments and is defined by the light-dark cycle, not by clock hours. Morning vulnerability was the key finding. Maximal myocardial injury when ischemia occurs in the early light phase, ZT1 to 5. Protection at night time. Minimal injury during the dark phase, ZT13 to ZT17, despite identical ischemic burden. Causality: depletion of neutrophils abolishes circadian differences in infarct size. Mechanism: high nighttime chemokine CXL12 activates CXR4, suppressing neutrophil circadian clock activity. Tissue effect: neutrophils relocate to the infarct core zone, sparing the border zone cardiac myocytes. Human relevance: in STEMI, higher neutrophil counts amplify circadian troponin release patterns. These are some eponyms and concepts related to this study. Hit pause and read at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.